Good morning. Thank you all for participating in today's media briefing. This is UPMC's 33rd since the start of the pandemic. I'm joined today by Tammy Minier, UPMC's Chief Quality Officer, Dr. Alejandro Hoberman, who is a pediatrician and president of UPMC Children's Community Pediatrics, and Dr. Rich Beggy, who's an obstetrician and president of UPMC Magee Women's Hospital. They will share with you new information about booster shots, vaccine for young children, and the effects of COVID on the unvaccinated pregnant population. After their remarks, we'll take your questions. Tammy?
Thank you, Paul. I really appreciate being here with all of you today, and I'd like to thank each of you ahead of our comments for your responsible reporting of this information over the last many months. You have been wonderful partners, and we appreciate it. We all know that the facts regarding COVID-19 have been difficult to follow at times, overwhelming even. When it's hard to keep up with all of this new information, it's hard to know what decisions to make. That's why these press briefings are vital, and while your reporting of the information from them makes such a difference to our community, and we really thank you for that again. It's important that the community members hear truthful, accurate information from trusted doctors and healthcare organizations and researchers, not from Dr. Google. I want to lay out 3 facts that I have come to use over the course of these months to communicate the importance of how we actually respond to what's happening with COVID today. First and foremost, wear your mask. You need to continue to wear the mask. The mask prevents transmission. That's what it does. It's super important. Second, get your COVID vaccine. I cannot say this enough. They are very safe and will help you and everyone around you really lessen the real risk, which we are sadly seeing, of infections that are ending badly. People die from COVID that are not vaccinated. It's important to recognize the risk of that death. Today, if you are unvaccinated, you have a 10 times higher risk of dying for COVID. I, for one, along with the people that I care about and the people that we work with, don't want to see that happen. And we don't believe that that is a risk worth taking because the vaccines are so very safe and effective. 3, if by chance you get sick, or if you are an individual that has had the vaccine and not been able to respond, please seek out immediate testing and remember monoclonal antibodies. Monoclonal antibodies save lives also. They are a very effective treatment, very safe, and they have allowed us to save multitudes of individuals over this past 20 months. So mask, vaccine, and if you have COVID, monoclonal antibodies. That's the recipe that's going to allow us to move from this pandemic to being able to continue to reemerge in a future state for the entire world. There have also been many exciting advancements regarding vaccination. We have some information that should be up on your screens at this point in time regarding boosters. Boosters have been evolving almost since the beginning of vaccine development. And all of us have even know of many other diseases where we've received booster vaccines to stay safe. COVID is no different than that. You can also get boosters with a lot of flexibility now. It's not as if you have to follow a single trajectory. And that's because the vaccines have been proven to be so effective and to actually work well with each other. We really want you to get your booster. If you're eligible, please do it. It will add that extra level of protection. If you want to talk about the choices of boosters, call your primary care physician or call us. We want to be a trusted source of information to guide you through some of these issues. Experts are necessary for all of us to be empowered and make our own decisions and make empowered decisions. Another great advancement that I'm super excited to be here with you today is to talk about vaccination in our younger kids. The 5 to 11-year-olds, as we know, were just approved earlier this week, and we began the vaccination of those kids on Wednesday and had a wonderful turnout and have continued to see very positive outpouring. But we have with us today one of our experts who I've had the privilege of working with, Dr. Alejandro Hoberman from our Pediatric Services program with Children's, is going to talk about our plans for vaccination of the 5 to 11-year-olds. And I hope each of you will listen really carefully to how safe and effective this vaccine is.
Thank you, Tammy. Good morning. The Pfizer COVID-19 vaccine for children 5 to 11 years is here, and we are ready. We have a lot of experience with this vaccine in adults and adolescents. It has been thoroughly studied in young children, and it showed the same outcome. It is safe and effective, and it will save lives. There have been 6.5 million cases of COVID in children of all ages in the United States, and 750 deaths overall. In children 5 to 11 years, almost 2 million cases. Over 8,300 children have been hospitalized, and over 5,000 children had multi-system inflammatory syndrome, or MIS-C, and 94 5 to 11-year-olds have died. During October, 10% of all COVID cases in the United States are in this age group. If there is a silver lining to this horrible pandemic, it is probably that poor outcomes or deaths for children who have COVID-19 are lower than for older adults. But still, COVID is among the top 10 causes of death in children. Children can have serious outcomes, and children can transmit the virus to vulnerable family and community members who are at high risk for severe outcomes. These include grandparents and family members or friends with cancer or other immune-suppressing illnesses. And vaccinated children may often carry the virus to them. More than 2/3 of hospitalized children have been Black or Hispanic. Tragically, 750 children have lost their life to this virus. This is 4 times greater than the number of deaths caused by any flu epidemic in the last 20 years. 750. Some may say the rates are low, but in my eyes, it's 750 too many. Each one was a child who lost a long future and who left behind those who loved them. We need to understand that this is now a vaccine-preventable disease, like measles or polio and many other diseases that affect children. As a society, we must protect our children, and the vaccine can do this. And UPMC, Children's Primary Care, and UPMC Children's Community Pediatrics are here to help. We have a thoughtful and equitable process that involves pediatric practices and community partnerships to ensure that every child in our region and the communities that UPMC touches will have access to the vaccine regardless of insurance status. The moment these vaccines were authorized, we began vaccination. Within 1 day, over 10,000 pediatric vaccination appointments have been scheduled. The majority of COVID-19 vaccines will be given at our pediatric practices. This is because families and children are comfortable in these offices, and giving vaccines is what we do as pediatricians. Our pediatricians will answer all questions that parents have about the COVID-19 vaccine. Along with trust, equity remains our core commitment. While we have a robust plan to distribute the COVID-19 vaccine at 55 CCP locations across Western and Central Pennsylvania and at children's primary care centers, we're also setting up community-based and school-based clinics as fast as we can. Just as UPMC has proudly co-hosted 57 school and 44 community-based vaccination clinics for children 12 and older, we're excited to do this for younger children by partnering with school districts and community organizations to protect our children and our community. Please reach out to us if you're interested in having a vaccine clinic in your school or your community. We encourage family members to talk to us about their concerns. Our clinicians at CCP and UPMC Children's want to hear your questions, and we want to have a dialogue with any family member about the benefits and risks of any pediatric vaccine, not just the Pfizer vaccine. That is what we're here for, to help explain the science and the data. The vaccine for children provides the lowest dose we can give them to protect them, which is 1/3 of the adult dose, and with the fewest side effects. It provides instructions or training for their bodies to recognize the virus and help the body mitigate or eliminate it. It trains the body and then it's gone. The vaccine does not stick around. Many concerned parents have asked specifically about myocarditis, which is an inflammation or irritation of the heart muscle. The most common symptoms are chest pain, shortness of breath, and sensation of an irregular heartbeat. Myocarditis is rare, likely 5 per million doses, and the vast majority of children fully recover promptly. Multiple sources of data in this country and abroad show that serious vaccine effects are very rare and that the benefits of vaccination against COVID-19 far outweigh the risks of vaccines such as myocarditis. Actually, the rates of myocarditis are much higher for people who get COVID-19 and usually more severe than those who receive the vaccine. One last point I would like to make. Across the United States, school classrooms close because of COVID cases. When this happens, we interrupt the education and socialization that children need. They need the sporting events. They need their friends. They need the activities, the learning, the birthday parties, and time with their grandparents, all essential in their development. If we all do our part, we can protect ourselves, our families, our neighbors, and our beautiful community and put an end to this pandemic. Dr. Beghi can now discuss COVID-19 and vaccination during pregnancy. Thank you.
Thank you, Dr. Hoberman. I'm going to start this morning with news you might not want to hear. The pandemic is not yet over. It isn't over even though we desperately want it to be. And sadly, it is not likely going away anytime soon. We believe that COVID-19 is slowly coming down and also transitioning to a common virus that we will all be living with for a long time, very similar to influenza. We still need accurate information at this vital time, and this includes an understanding of the range of protections that COVID-19 vaccine provides to all populations to guide our efforts to keep us all healthy now and well into the future. I'm an obstetrician, and I'm the president of UPMC Magee Women's Hospital. And I want to talk to you this morning about pregnant women who, as we always have suspected, are at a clearly higher risk for severe outcomes should they get COVID-19. The good news is that this is a largely preventable problem. I'm very happy to report that among the tens of thousands of women who have been closely studied after they chose to get the COVID-19 vaccines, the data is clear these vaccines are safe. This large group of moms-to-be who received the COVID vaccine around a year ago and have given birth to thousands of healthy babies without any evidence of negative effects on their pregnancies. Similarly, tens of thousands of women have received the COVID-19 vaccine before getting pregnant and have not had any struggles related to infertility whatsoever. The often mentioned but completely unsubstantiated concerns about COVID-19 vaccines causing either miscarriages or other problems with their pregnancy or causing problems getting pregnant is a complete myth, plain and simple. What is not a myth is the harm that COVID-19 can have on pregnant women and their unborn babies. Because of the risk to anyone pregnant and the demonstrated safety record that we now have, the CDC and UPMC recommend these vaccines for all pregnant patients. Premier organizations for obstetricians and gynecologists, like ACOG, also have this same recommendation. And because we are not concerned about the safety of these vaccines, and we believe in the high efficacy, we believe and host vaccines specifically for pregnant women. We are hosting our next pregnancy vaccine-specific clinic on November 17th, where we will give more primary series to all pregnant women who present, as well as booster doses. Unfortunately, and often due to this misinformation that I have talked about, Only roughly a third of pregnant women across the country have taken a COVID vaccine. And sadly, in our region, these vaccination rates appear to be similar for our pregnant population. Here in Pittsburgh, specifically at UPMC Magee Women's, we see the devastating effects of COVID-19 in unvaccinated pregnant women. These are healthy, young women, otherwise ecstatic to be pregnant, women beaming with joy at the thought of becoming mothers, and who are sometimes becoming critically ill with COVID-19. This does not need to be this way. It does not need to happen. Some others have unfortunately lost their lives, and others were so sick around the time of delivery from COVID-19, they have not been able to see their newborn for weeks. I am imploring all moms-to-be to make an informed decision based on real information from trusted professionals. Again, what you might have heard in various venues about negative effects of COVID-19 vaccines on pregnancy are myths. They're not true. At our upcoming and next COVID-19 vaccine clinic on November 17th from 2 to 5 p.m. at UPMC Magee Women's Hospital, we will be offering vaccine to all pregnant women who present who need their first, second, or are interested in a booster dose. And as important as providing the vaccine, it's also a clinic with top obstetrician and gynecologist present who will be on site to answer any questions you might have. To women who are still considering, please come if you have questions or concerns. We want to start a dialogue with you. We want to provide you with facts so that you are equipped to make the right, informed decision for yourself, your baby, and your family. Thank you.
Thank you, doctors. Thank you, Tammy. And now we'll take questions from the media. You need to go to the bottom of the page to press the raise your hand button. That will put you in our queue. I will read your name off. Your line will be unmuted for you to ask your question. Please remember to unmute the microphone on your end as well. We're going to try to call on as many different media outlets as we can in the time that we have allotted. First question, Paul Goff, Pittsburgh Business Times. Paul, please go ahead.
Well, and thanks for having this session. I'd like to ask about the vaccine mandate that was just announced yesterday by CMS. Some specifics about how UPMC is going to kind of carry out this mandate, given that it's different from the strategy you've had since the vaccines were out for your employees, and then also whether you're concerned about losing employees either voluntarily or not so voluntarily.
Tammy, you want to tackle that?
Absolutely. Paul, thanks for raising the question. It's a very important question, and it's one that, as you can imagine, we've had literally a little over 24 hours to try to digest the mandate. However, it is not UPMC's first experience in dealing with the mandate. You may recognize and appreciate that we have facilities and services within Philadelphia, within Maryland and New York, and we have successfully navigated those situations. We believe in vaccination for our employees, and we support it at every level. And as we have worked through that and through those mandates, we have been able to successfully achieve very, very high levels of vaccination and certainly compliance with the intent of the mandate. What we've also done is, because of that work and I believe a thoughtful leadership approach, where we have had a very small number of individuals who really chose to not be interested in pursuing it, we've been able to find them alternative places that are not clinically facing jobs within UPMC. So it's our job to work with our employees, to engage them, to educate them, as we are here today in this press conference, and also to work very hard to meet the intent of what our regulators want to see, which is what we all want to see. We want to see more vaccination in the United States. We want to see more vaccination in communities, in employees, and at every level feel that the responsible information we're providing helps make that easier. So yes, we're studying, we intend to comply, and we intend to follow all of those objectives, along with making sure we can still take care of the patients that present to us every day in parallel to that.
Okay, thank you, Tammy. Next question, Mick Stinelli, Pittsburgh Post-Gazette. Mick, please go ahead.
Hi, thank you. I was wondering, when it comes to children getting the COVID vaccine, are there any particularly effective persuasion techniques or persuasive talking points that have been used to convince parents that this is an effective and safe vaccine for their kids?
Dr. Hoberman?
So thank you for the question. In general, there is the belief that COVID-19 is rare in children, but kids are getting a lot of COVID. So it is a severe disease. The fact that these vaccinations are happening in the pediatrician's office is the most important component. This is the place where our patients trust us and communicate with us. The concept that the vaccine is a temporary thing, it trains your body, as I said before, trains your body, teaches you as an invisible coach, and then it goes away. There is no long term, it doesn't stay in your body, it doesn't stick in your body. And the adverse events of the vaccine are much lower than the adverse events, the symptoms of COVID. So it's only minor pain at the site of injection. It could be low-grade fever, it could be headache, it could be fatigue, but it's very short-living. It's only for 1 or 2 days, and then it goes away. So communication, we'd love you to help us communicate to the families. This is the first step. Communicate with the media, and then we will communicate, and we started to communicate with the families as we see them, and we're holding vaccine clinics and community-based and school-based efforts to communicate and deliver the vaccine to the children.
Thank you, Doctor. Next question, Kylie Walker, WTAE-TV. Kylie, please go ahead.
Yeah, thank you. Just wanted to ask a follow-up question about kind of the myths that were spoken about earlier. How do those myths and, disinformation that you see on social media impact the work that you all are doing when it comes to, we just got this vaccine approved from the CDC for younger kids. And then also, the progress that's being made in terms of fighting this pandemic.
Well, let's start with Dr. Beghi. He's pretty strong on this.
I think that they have an impact. The misinformation absolutely has an impact, but what we're hoping and why we're here is that people that are digesting that misinformation or information also realize that we're here as a trusted source to help them sort through that information and present the facts to them and present a balanced discussion on the issue that is not simply talking about what the theoretical risks of the vaccination may or may not be, but what are the risks of not being vaccinated? And that's one of the things that I was talking about earlier and Dr. Hoberman were talking about earlier. There are real risks that we're seeing every day from people that are choosing not to be vaccinated. They're choosing to put more emphasis on the misinformation. So again, I implore you to think of all the information that's out there, engage with your providers, whether it be a pediatrician, an obstetrician, or a PCP, get the facts and make a decision based on both sides of that equation. Because focusing just on the misinformation is really not fair to yourself because that's not all the information that's out there.
I'd like to follow up on that a little bit. And emphasize one of the points that I made earlier, and that was the issue that if you are an unvaccinated individual, you have a 10 times greater chance of dying. I can't tell you how many times I've had conversations with friends, colleagues, community members, patients that have said to me, but I'm healthy, I'm fine. If I get COVID, I'll be fine. That's not the case. That's not always the case. And by making the decision to not do that, you essentially are taking a risk with your own health. And when you listen to Dr. Beghi and Dr. Hoberman, and you think about the people that you love and you care about every day, are you really wanting to take that risk with something that is preventable? And I think the other point that Dr. Hoberman made, I'd just like to emphasize again, that was certainly very important knowledge for me. I learn from my expert physicians every day, is the fact that the vaccine teaches our body how to respond, and then it goes away. It's a tool to allow our body to learn. And I think that is part of why there's such lingering fear at times. Well, I just don't know. I just don't know. I think Dr. Beghi's provided some very powerful data about women and their pregnancy. We do know. And the same way with our children, we do know. So I think the emphasis on knowledgeable, factual information is the best thing. We love empowered, engaged patients who actually have done their work. And if you have questions, please just ask.
Okay, great. Thank you, Tammy. Next question, Taylor Toshef from WHTM-TV in Harrisburg. Taylor, please go ahead.
Hi, I was just wondering if you could reiterate how many appointments were made for those 5 to 11-year-olds the first day they were able to get those vaccines.
Thank you. It was 10,000 appointments during the first 24 hours that we opened up the online access.
Thank you.
Thank you.
Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead.
Thank you. What non-patient facing positions can UPMC offer to those who don't want to be vaccinated, given that you have more than 100 employees, far more, and will need to require all of them to be vaccinated, as I understand it?
Yeah, Bill, it's a great question. And it's one that gets down to the complexity of business unit structure and detail that are far beyond the means of a press conference here. But as you know, UPMC is a very large global company that has all kinds of different facets to it. Now, as we look at the mandates in the last 24 hours, that's why we are examining them very closely, because we do believe in vaccination for all. And as you know, this has also been an evolving conversation. I can't tell you how many times each of the states, even when they have placed mandate discussions out there, 1 minute it's, yes, you can have a religious exception. No, you can't. Yes, you can. No, you can't. So it's a little evolving, and to put a kind of that stake in the ground here in a public forum that could be easily misconstrued as we learn more is not really responsible. So I would ask you to stay close to us, and as we understand, our intent is to see our employees vaccinated and to comply, and also do that in the best way possible.
Okay, again, please press the raise your hand button to be put into our queue so we can get to your questions. I have an email question. Dr. Beghi, why does UPMC and our region have such a low rate of pregnant women getting vaccinated?
Yeah, that's an excellent question, one I've thought about a lot. I think that pregnant women are appropriately concerned for their health and their unborn baby's health. But I think, unfortunately, there is a focus more on the theoretical risk versus the real risk of the disease. And that's why we're here saying this message. This is the same message we've been sending for some time, and we will continue to send this message, and we will continue to ask you to speak to your physicians. It's normal to be concerned about your own health. It's very normal to be concerned about the health of your unborn baby or your newborn baby. But realize that the data consistently has shown that these vaccines are safe, highly effective at preventing disease in the mother, preventing them from being hospitalized. And to follow up on what Tammy was saying, nearly every woman who has been critically ill at McGee has been unvaccinated. So that same trend that you see in the regular population exists in the pregnant population as well. This is, at this point, primarily a problem of unvaccinated folks. So please reach out for information. That's what this pregnancy vaccine clinic a couple weeks from now is about. We're happy to answer any questions. We just want to begin the dialogue so that you can make the best decision for yourself and your unborn baby.
Tammy.
I would like to follow up on that too. And Rich, I've heard you speak intently about how not only does it protect the mom, it protects the unborn baby. And that we have been able to see through evidence and detail how the antibodies that are created pass through to the newborn, which I think is equally important, knowing that the current vaccination studies for newborn forward are still under review and careful review. So I think that adds a lot. I also want to emphasize that on the adult side, for non-pregnant women, people that are just admitted to the hospital today, by and by, the majority are not vaccinated. There are those that are immunocompromised, as we've referenced on several occasions, whose bodies just can't respond to any vaccine, not just this vaccine, any vaccine. And so we see the same trends. The people that are dying are unvaccinated. The people that end up in the ICU, unvaccinated. So please let that just sink in and process that as it relates to how important getting the vaccination is for your health, your family's health, and for the people that you care about.
Thank you. Next question, Julia Zenkovich from WESA FM. Julia, please go ahead.
Thanks. Hi, I was wondering about the Pfizer pill. I know Pfizer announced this morning it was going to ask the FDA and other regulators to authorize its COVID pill, which is meant to kind of cut some of those hospitalization and death rates. What do you know about the timeline for completing this FDA review and releasing the pill?
Well, that's a great question, and one that congratulate you for staying right up to date on the information. We are excited about the announcement. We have been watching closely the development of different treatment agents for COVID across many of our drug manufacturers in the world who have really leaned in and tried to make an impact. So we welcome it. We recognize that the announcement today was from the manufacturer themselves, right? Which always requires, from our perspective, the true validation from the FDA, the CDC, and others regarding its effectiveness. Now, the timing of that is hard to predict, as we've all seen. We think we know things are going to come maybe in weeks, but then again, it could be months. But we will watch the evolution every step of the way, and we are excited to see the preliminary data that allows us to believe this could be a very effective treatment, and one that you can be assured the moment that it's available for patients, or for us to even understand further work with the patients, we will have it, and we will get it to our people.
Thank you. Next question, Jocelyn Howard from WGAL TV in Lancaster. Jocelyn, please go ahead.
Thank you. So what is, I guess it could be for anybody, it could be for pregnant women, adults, or parents looking to get their kids vaccinated. What is your message to those who hear that it's low risk right now, that that we don't see a lot of side effects from the vaccines, but are questioning how it will affect them or their child 5, 10, 15 years down the road, if they're wondering if there's any effects that we just might not know about yet?
Dr. Hoberman, you want to start, and then we'll go to Dr. Beggy.
Well, it's very similar to what we said before, that this is not a vaccine that sticks around in your body. It gets eliminated fairly fast. It trains how to mitigate and eliminate the virus, and then it disappears. Rich, you want to, Dr. Beggy?
Yeah, I completely agree with that, and I think that is a concern that has come up for decades with vaccines. And the truth is that those concerns have never borne out to reality. That comes up every time there's a discussion around immunizations, especially when there's new immunizations. And to follow up on Dr. Hoberman, there's no traces of the vaccine left after a few days. But what is left is the protection it offers that Tammy appropriately reminded me to mention, that not only does that protection exist in the mother, but it's passed through into the baby and lasts into the newborn circulation for up to 6 months. So it's a really powerful way to prevent disease in the mother and in the newborns. And there's really no reason to believe there'll be some things uncovered 20 years from now. That's been a concern that's been there for years, but it never bears out to anything. And it kind of, in my opinion, inappropriately focuses on the wrong thing, which is the right thing to focus on is what's going on right now and what we're seeing, unfortunately, which again is preventable.
Tammy.
And I only want to add a little bit of a point to all of that. And that is, every time any of us are sick with anything, we go and seek care. And that care is provided based on what we need at that moment. And that care is based on evidence and the exact same processes that we have used as a country for decades to know that what we're being offered today is safe. If I have cancer, what are the long-term effects of any treatment? If I have COVID, we are now almost questioning those processes. And I'm here to say those processes are sound and effective. And while the world will continue to evolve in its understanding and adapt in its understanding, everything we know today, based on everything we've learned for decades, is true.
Okay. Next question, Ashley Little from northcentralpa.com. Ashley, please go ahead.
Hi, thank you. So given the wide range in size and growth amongst children, is the pediatrics dose equally effective for all children ages 5 to 11, or will certain groups require additional boosters?
Thank you for the question. The dose that is being used in children 5 to 11 is 10 micrograms, which is a third of the adult dose. In the 12 to 17-year-old group, the dose is the same as the adult dose, 30 micrograms. Yes, the dose was studied in two equal doses across that age group in the study that involved 4,500 children. And that's the dose that will be used during that time frame. Now, children will turn their birthday. They will start at 11 and then they will turn 12. And that's still a debate happening at the American Academy of Pediatrics as to whether they should receive, if for the second dose they are already 12, whether they should get the 11-year-old dose or they should get the 12-year-old dose. And it probably is going to be the 12-year-old dose if they turn 12 after the first dose 21 days later.
Okay, thank you, Dr. Hoverman. Thank you, Dr. Vaghi, and thank you, Tammy. That concludes all the time we've allotted for today's press briefing, and thank you to the media for attending. In about 45 minutes, we will send all the attendees a link to download high-resolution footage of this press briefing, which we encourage you to use in your news reports. If you have any follow-up questions, please contact UPMC Media Relations Department. And as always, please follow @UPMC News on Twitter for updates. Thank you very much.